Dr. KJ Walia here. I've been part of custom care now for quite some time and graduated medical school in 2012. Finished my residency in West Virginia in 2016. I've been privileged to work with custom care for quite some time now and am a local physician in the community here. So actually I've seen quite some sick patients that have had, exacerbations of their chronic illnesses, and, having that conversation to transition to hospice is always tough, but, I've definitely seen some patients and their families have that sigh of relief and have that moment where they're, feel at ease. And with the support and the team structure that custom care has, I've had conversations with families and such afterwards, and they just have a sigh of relief and they're just so happy that they followed through with custom care and the hospice setting. So it's really good to see how patients are responding and really need that resource and really take advantage of it and benefit from it. A common misconception is that cancer is only one of the main diagnoses that can qualify you for hospice. However, chronic conditions such as dementia, such as Alzheimer's, vascular dementia, Lewy body dementia, along with failure to thrive, protein calorie malnutrition, dysphagia, and comorbidities associated with that can also qualify you. Dementia is a progressive disease, and with that we know there's no cure. However, symptoms can come and go and get worse, and therefore why not surround yourself with a team of caregivers, physicians, and nurses that can help slow down the progression and manage the symptoms. With hospice, you actually have the luxury of having a 24-hour caregiver team that comprises of nurses, physicians that can come to your facility or home at any given time. So there are a lot of hospice companies out there and work with in the hospital system that I'm with. I chose custom care because of their how well known they are within the community, how well they're known within the hospital itself and the hospital system and our palliative care team, as well as being integrated into the team. I find that they have a really strong core all the way up from leadership to nursing to aides, and I feel very happy to be a part of that team. So during my time with Custom, I've actually been able to fortunately be a part of several processes, whether it is discussing with the patient and family with Lacey, who is a great first point of contact, as she makes everyone feel very at home, very relaxed, and really gets to that level. She's very patient and takes her time, which is something you don't really see in the hospital setting where everyone's on the go. So it's really refreshing and nice to see that level of attention and that level of sincerity that she does provide her patients. And then I've also been able to, witness nurses like Tasha and Shamanika who have helped me out through my, starting days to where I am at now. And there was a learning curve, but with the team behind you, they don't leave you behind. They really help you excel and really help you do good. And at the end of the day, that translates into the patient care, which is they just really care a lot, and they're very responsible. Coming into hospice, you hear, you're dealing with a lot of patients, you're dealing with their families, you're dealing with some severe medications and medical problems, and so to have a team that is dedicated to the well-being of their patients as well as their families, and also being responsible on the back end to make sure what they are doing is standard of care, really makes it a pleasure to work with, seeing all that follow through. If I or anyone else I was close to ever needed hospice services, I would without a doubt choose custom care, and I'm very confident in their services and quality of care to myself or anyone. I'm very thankful to be part of the team, and I'm very much looking forward to a very bright future.